diabetes is the second leading cause of death after tuberculosis in South Africa, and that's at least according to the latest stats from Statistics South Africa. Today, as we commemorate World Diabetes Day, health activists are still calling on government to review the sugar levy in order to help curb the disease. During this year's budget speech, the finance minister locked the levy for 2 years. So how can other countries, or rather how have other countries dealt with this, and how will this benefit South Africa in the long run? Let's have the discussion now with Wits researcher and founding director of Priceless SA, Professor Karen Hofman, who joins us via our video link this morning. Prof, it's lovely to have you on the program. Thanks very much indeed for making time to speak to us on this really important issue. Perhaps let's begin by just understanding the situation as it stands. I mean, as I've just mentioned there, that diabetes is the second cause of death in South Africa, and it comes in a context where there is an increase in deaths caused by non-communicable diseases. What underpins this?
Thanks so much. Yes, this is really a serious issue in South Africa. It's growing. Diabetes, type 2 diabetes, which is the most common form of diabetes in the country and across the globe, it's doubled in the last decade. It's due to double again. It's costing the country an absolute fortune. We really need to take care of people who develop diabetes, and it's costing the Treasury and the health system currently 20 billion rand a year, and by 2030 it will be 35 billion rand a year. And that is because people are diagnosed very late, people are not screened early enough, people don't get treated, they don't get monitored. It's a very serious condition. It's difficult to treat.
Yeah.
And it's very difficult to do that. So the real issue is we have to do a lot of work on prevention and preventing people from getting the disease in the first instance. And that is really trying to change change our environment, getting the healthy choice, the easy choice as we eat, and that is in direct contrast to what is actually going on around us.
Right.
So we really need to have some things in place that affect the population's health, and that is really up to the government. We have a very serious problem because the world that we live in, not only in South Africa, but particularly in South Africa, is that we live in an environment where we're encouraged to eat and drink, in particular drink very sugary beverages, and we are promoted these sugary beverages from an early age, as if they are things that we will make our lives better. In fact, would make our lives worse.
Sure, and that's where I suppose the debate around increasing the sugar tax actually comes in. I mean, the minister has already made a proclamation that the levy is going to stand as is for the next 2 years, and I wonder what your reaction to that is. And as you answer that question, there's also going to be questions from economists among us who ask about the price elasticity of the sugar tax. In other words, does making this more expensive necessarily mean consumers respond by buying less of it?
Well, let me just say a couple of things about that, about what's called the price elasticity. So what do people, if you drink less sugary beverages, what do you drink? And the answer is that we've done an evaluation after the first year of the sugar tax in South Africa, which was 2019, and we showed actually that we looked at all the evidence, and the fact is that people do drink fewer sugary beverages if the price is increased enough, and they drink other beverages. So they drink water, which is exactly what we should be drinking. There's nothing wrong with water. It's natural. It's not promoted by some overseas company that has come here to colonize our health. And this is a major issue. Unfortunately, the government promised to increase the sugar tax 2 years after it started, which is in 2019. Nothing has happened. And that hasn't even been increased for inflation. So we're in a very difficult situation in South Africa. Many countries in the world, over 50 countries in the world now have a sugary beverage tax. which in South Africa is called the Health Promotion Levy. And this Health Promotion Levy was meant to increase after 2 years. The Treasury said at the time in 2019 they would increase it after 2 years. They've told us every year after that they will increase it after 2 years. They haven't done it. They haven't even increased it for inflation, and so the usefulness of this tax is less and less for South Africa. Unless we increase the tax, we're not going to prevent obesity, which leads to diabetes, which leads to very serious complications for many people in South Africa. We're looking at a shocking state of affairs in South Africa. We're 10% of the population, 12% of the population. It's 5 million people in South Africa.
That's interesting. Yeah, if I can come in there, Prof. I hear you. You mentioned that, you believe that the sugar tax will have the desired effect if it's increased enough. My understanding is that when it was first introduced in 2018, it was at around roughly 11% of the price of the product.
That's right.
How far up do you reckon it needs to go for it to start working then?
Well, it needs to be adjusted for inflation, and it needs to be 20%. The World Health Organization has said that is the number that will give us what we call the best return on investment. We will prevent diabetes, we will prevent obesity, we will prevent overweight to some degree. There needs to be a series of what we call policies, preventing marketing to children, preventing marketing in general, and labeling of what's in these products. People don't really know what they're eating or drinking in general. So we need a series of policies, including an increase in the sugary beverage tax. That is the thing that has made the most difference. It made the most difference to smoking in South Africa when we introduced a tax on cigarettes. It decreased smoking from 40% to 20% over 20 years, and we could achieve the same thing with an increase in the sugary beverage tax. It's highly irresponsible not to increase it. And there's a lot of discussion. For example, the people who think that this shouldn't happen think that there's going to be massive layoffs. That is simply not true. That isn't what happened with tobacco. There have been also studies done across the globe looking at what happened with the sugary beverage tax in many countries across the globe, and there has not been a massive layoff of people. So a lot of the issues around the sugar industry are, of their own doing, and the issue really is it's about the sugar master plan not being introduced in South Africa properly and not being monitored. People keep saying it's going to be the sugar master plan will be done in South Africa, but that has not happened. In 3 countries around the world, the top 3 sugar-producing countries around the world, Brazil, India, and Thailand, those are the top 3. Those countries have introduced sugarcane to be transformed into ethanol. Why has this not happened in South Africa? We're in a serious energy crisis, and we need to do this.
That's very interesting. Again, as you've mentioned, there's been a charged debate about this, and I wonder if there could be, a number of approaches, as you've mentioned. Increasing the tax is perhaps taking the hard line, right? Punishing people where it hurts, which is their pockets, and driving or changing their behavior in that way. But what about going on the charm offensive, right? Speaking more about what the benefits are if people were to make the choice themselves without feeling like they've been compelled to do so because they simply can't afford it anymore. How well are we doing on that score, convincing people rather than in some ways compelling them by increasing this tax?
The thing is, unfortunately, we've shown in many different cases, and I use the cigarette tax as an example, unfortunately, it doesn't really work. There needs to be a series of things. The charm offensive, people are not going to do it. They just don't. We've got an inbuilt resistance to it, and the marketing is relentless. Drink this, it will make your life better, you will open your life to so much better things. It doesn't happen because there's a what we call an obesogenic environment. There's an environment around us that creates a situation where we become overweight and obese. It's very difficult to resist. The marketing companies know how to get into our brains.
And perhaps those are the marketing companies we should have on the side of those who believe there are more health benefits to this, right? But point taken. And thanks very much indeed for helping us ventilate this important aspect of our discussion on this World Diabetes Day. Professor Karen Hofman is a Wits researcher and founder of Priceless SA. Really do appreciate your time.